So, as per your request, I am once again revising the topic larynx. So, this topic asked for the 10 marks question. So, maximum important point of larynx is intrinsic muscles of larynx. That is only little bit difficult, so that you can remember. Otherwise, all parts and introduction and all that is a very common that you can remember. So larynx, I have told the brief introduction we are going to deal. The larynx is an organ for the production of voice. So it is also an air passage and acts as a sphincter at the inlet of the lower respiratory passage. Here you can see it is a sphincter like acting here at the upper part of the trachea. Larynx is situated. So remember about it acts like a sphincter at the inlet of the lower respiratory passage. We can divide the respiratory passage into upper respiratory passage and lower respiratory passage. So here you have to remember about all these nose and nasopharynx and oropharynx are included in the upper respiratory passage, and we have the larynx, trachea, and bronchus and lungs. They are included as a lower respiratory passage. So larynx lies in the anterior midline. Now we are talking about the situation and extent of the larynx. Extent, it is situated at the anterior midline of the, here you can remember, anterior midline of the neck, extending from the here root of the tongue to the trachea. We have trachea here, and this is the root of the tongue. From that it is extending. It lies against the cervical vertebrae, third, fourth, and fifth and sixth cervical vertebrae. That you have to remember. Then size of the total length and size of the larynx, you have to remember. The 44 mm in males and 36 mm in millimeters, it is females. So until the pubertal age, both the larynx are same in size. But pubertal, after the puberty, the male larynx grows rapidly, becomes larger than the female. So that is, there is a change in the voice. After at the pubertal age, male voice changes. It is because of the growth of the larynx. It may be considered that is the hormonal changes in the body, cartilage's development. So that 44 mm in males and 36 mm in females. That you have to remember. Last time I have told the constitution of the larynx. The larynx is made up of the skeletal framework of the cartilages. The cartilages are connected by the joints, ligaments, and membranes. So we have the totally larynx. You can see anterior view and posterior view. So you can see the anterior view, that is all totally, it is a made up of the cartilages, skeletal framework of the cartilages. So connected by the joints, ligament, and membranes. So you have to whatever the each cartilages are connected and by the ligaments and moved by the muscles attached to it. So that is you have to remember. So skeletal, or you can remember about the cartilages of the larynx. So last time I have told in the last lecture that is the cartilages of the larynx are three. They are classified into a total 9 cartilages, and they are grouped into two. 3 are unpaired and 3 are the paired. 3 unpaired cartilages are, you have the thyroid, epiglottis, and cricoid. So we have the epiglottic, thyroid, and cricoid. They are the unpaired cartilages of the larynx. Paired cartilages, which are situated posteriorly, they are the arytenoid, corniculate, and cuneiform. So you have to remember about this all, and very important to know, remember, totally remember about the in the diagram, that is the epiglottic, thyroid, and cricoid. This is you have to remember. Here also this is a thyroid, epiglottic, and cricoid, and this is a continuation downwards here, as that is the trachea. So this is very important for the study for the intrinsic muscles. So whatever I have told, the muscles of the larynx. So intrinsic muscles of the larynx, very important part. At least you have to write 5 to 6 muscles, its origin, insertion, and few diagrams of this. So whatever the question is asked about the larynx, small muscles, very small, and their origin, insertion, we have to write. And it is very difficult unless and until you remember the all cartilages of the larynx. So directly before that, you have to remember about the here lateral view, shown the lateral view in the diagram, thyroid cartilage and cricoid cartilage, that you have to remember. So I have already told in the last lecture, you should know the and remember the totally the cartilages and its diagram. Then only you can understand. So next, almost all the muscles which are attached to the larynx, they are attached to the each other to the cartilages, and during the these cartilages moved by the attached muscle, and according to that, even vocal cords opening and closing, epiglottis, and other tensing the vocal cord and relaxing, all these actions occurring at the intrinsic muscles of the larynx, and they are done by the muscles attached to the larynx, and those we call as the intrinsic muscles of the larynx. So intrinsic muscles of the larynx, there are 9 you have to remember: cricothyroid, posterior cricoarytenoid, lateral cricoarytenoid, transverse arytenoid, oblique arytenoid, aryepiglotticus, thyroarytenoid, vocalis, thyroepiglotticus. So name itself gives you the attachment of the from which cartilage to the which cartilage they are attached. Cricothyroid means you have to remember cricoid cartilage to the thyroid. Cricoarytenoid, cricoid to the arytenoid. This is the transverse arytenoid, arytenoid cartilage to the arytenoid. Oblique arytenoid, this is also going to the attachment to the arytenoid. Aryepiglotticus, arytenoid and epiglottic fold. Thyroarytenoid, thyroid and that is a arytenoid cartilage. Vocalis, vocal cords. Thyroepiglotticus, thyroid to the thyroid cartilage to the epiglottis. So you have to first remember the from the name, that is the origin and insertion, that gives the idea about the where they are taking origin and insertion. First muscle, that is we are going to deal cricothyroid. This is the one intrinsic muscle lying on the external aspect of the larynx. You can remember here, this is lying on the external aspect of the larynx. Even we can call this as a name the extrinsic muscles of the larynx. So you have to remember about the cricothyroid is included as an intrinsic, but it is lying outside, so that it is also we can include as an extrinsic muscle of the larynx. So remember, totally the cricothyroid is a one which is an intrinsic muscle of larynx, but it is lying outer aspect, so it is also called as an external aspect lying of the larynx, so that it is a one which is an extrinsic muscle. Origin is lower border and lateral surface of the, here you have the lower border and lateral surface of the cricoid cartilage. This is a cricoid cartilage and this is a thyroid cartilage. So origin of cricothyroid is from the lower border and lateral surface of the cricoid cartilage, and these fibers runs backwards and upwards and inserted into the inferior cornu of the lower border of the thyroid cartilage. So this is the superior cornu of thyroid, this is the inferior cornu. This is a superior border and this is the inferior border of the thyroid cartilage. So that insertion will be, that is the inferior cornu and lower border of the thyroid cartilage. So this is all about the cricothyroid muscle. Next, which is we are going to get about the, that is the posterior cricoarytenoid muscle. This is a posterior crico. This is a cricoid cartilage and this is a arytenoid. This is the one triangular muscle which is lying on the posterior aspect, originates from the posterior surface of the lamina of the cricoid cartilage. This is we call as the lamina of the cricoid cartilage, posterior surface, that is the origin of posterior cricoarytenoid. Then insertion, these fibers runs upwards and laterally are inserted into the muscular process of arytenoid. See, when you see this is arytenoid cartilage, we call this is apex and this is we call as a muscular process of the arytenoid. So this muscle, that is the posterior cricoarytenoid, arising from the lamina of the posterior surface of the cricoid, fibers runs upwards and laterally, and that is attached insertion at the, that is the muscular process of the arytenoid cartilage. So these are we call as a muscular process of the arytenoid cartilage. So this is about the posterior cricoarytenoid muscle. Next comes third muscle, lateral cricoarytenoid muscle. So when you go to the lateral cricoarytenoid muscle, you can see here lateral cricoarytenoid muscle. Lateral part of the upper border of the arch of cricoid. This is the cricoid cartilage, thyroid cartilage, epiglottis, that is you can remember. The lateral cricoarytenoid is originating from the lower part of the upper border of the, this is the lower part of the upper border of the arch of the cricoid cartilage, and these fibers runs upwards, whatever these fibers runs upwards and backwards, inserted into the muscular process of the arytenoid. You can see the arytenoid muscular process now very well, as we have come across in the posterior cricoarytenoid, you can see here. So the lateral cricoarytenoid is originating from the upper border of the arch of the cricoid cartilage. Then I have told the runs upwards and backwards, inserted at the, you have the muscular process of the arytenoid cartilage. So we have completed the cricothyroid, posterior cricoarytenoid, and lateral cricoarytenoid. These are the three muscles we have covered of the intrinsic muscles of the larynx. So next comes about the transverse arytenoid. You have the transverse arytenoid is the only unpaired intrinsic muscles of the larynx, unpaired. This is only one muscle. Otherwise, we have right and left two muscles, almost all the paired muscle, intrinsic paired muscle. But this is a transverse arytenoid is a one unpaired intrinsic muscle of the larynx. Its fibers runs transversely. Why it is named? Its muscle fibers are running transversely from one surface, posterior surface of one arytenoid to the another. In the diagram I am showing you, this transverse fibers we are going to call as a transverse arytenoid. And this is unpaired means only one. We have no, there is a specific two muscles right and left. So that is we call as a transverse arytenoid. That is the fibers run transversely from the posterior surface of the one arytenoid cartilage to the opposite of the other arytenoid cartilage. Means posterior surface of one arytenoid to the posterior surface of opposite arytenoid. These muscles fibers running transversely called as a transverse arytenoid muscle. Then comes about the oblique arytenoid. These are the slips of the muscle that runs obliquely. How the transverse muscle fiber, according to that name, is given. They are crossed each other at the midline obliquely, and that is we are going to call as a oblique arytenoid muscle. These are the slips of muscles that run obliquely here, obliquely, and crosses the midline across each other, each slip arising from the muscular process. Here you can remember, I have told posterior cricoarytenoid inserting at the, that is a muscular process of arytenoid. Now I am talking about the oblique arytenoid originating from the muscular process of the one arytenoid and inserting at the apex of the opposite arytenoid. So arising from the muscular process of one arytenoid cartilage inserted into the apex of the opposite arytenoid cartilage. Very important. This you have to remember. This is the posterior surface, posterior lamina of the posterior cricoarytenoid, and transverse arytenoid, posterior surface of the one arytenoid to the insertion to the posterior surface of the other arytenoid. Oblique arytenoid arising from the muscular process of the one arytenoid cartilage and inserted at the opposite apex of the opposite arytenoid cartilage. So that is you have to remember. Next comes about the aryepiglotticus. That is the sixth muscle is aryepiglotticus. This is made up of the some fibers of the oblique arytenoid where the continued into the aryepiglottic fold and run into the edges of the epiglottic cartilage. This is the edge of the epiglottis. This epiglottis, edge of the epiglottis, running into the aryepiglottic fold. They are there, and they are oblique arytenoid. Whatever these oblique arytenoid muscle fibers extend into the aryepiglottic fold and attach to the edge of the epiglottis, that is we call as an aryepiglotticus. Means you have studied the origin insertion of oblique arytenoid, same as these muscle fibers extend to the aryepiglottic fold and attach to the margin of the epiglottis. So that is we call as a aryepiglotticus. Okay. Then comes about the thyroarytenoid. When you go to the thyroarytenoid, here you can remember about the thyroarytenoid. Thyroid cartilage to the arytenoid cartilage. Thyroarytenoid originates from the posterior surface of the posterior aspect of the angle of the thyroid cartilage. This is the thyroid cartilage and adjacent part of the cricothyroid ligament. So originating from the posterior surface of the thyroid cartilage, inserting at the here, inserting fibers runs backwards and upwards, reach to the anterolateral surface. This is we call as the anterolateral surface of the arytenoid cartilage, originating from the posterior surface of thyroid cartilage and inserting at the anterolateral surface of the arytenoid cartilage. So this is we call as an arytenoid cartilage, and that is a posterior, that is the anterolateral surface of the arytenoid. So that is about the insertion. Next muscle comes about the vocalis. Vocalis you can see about the vocal cords attachment, and this vocalis you have to remember about the one which is a eighth muscle, vocalis. This vocalis is made up of the some fibers of the thyroarytenoid. Whatever we have come across the thyroarytenoid, and those muscle fibers which we are named as attached to the vocal fold, and those we call as this thyroarytenoid. These fibers attached to the vocal folds. These are the epiglottis. So that this is an insertion and attachment of the vocalis. Vocalis is made up of the some fibers of thyroarytenoid. This is all about the thyroarytenoid muscle arising thyroarytenoid, and that is a gain attachment to the Hocal ligament. We have here Hocal ligament, they are attached, that is we call as an Hocalis muscle. Then last muscle is thyroepiglotticus. This thyroepiglotticus, this is attached some of the upper fibers of the, this upper fibers of the thyroepiglotticus curve upwards into the aryepiglottic. This is a curve upward, means these two fibers we are going to call, that is the thyroarytenoid muscle. And this thyroarytenoid muscle, upper one runs upward, curved upward into the aryepiglottic fold and reach to the edge of the epiglottis. This is all about the epiglottis. And these constitute the thyroepiglotticus. This thyroepiglotticus means attaching to the thyroarytenoid muscle fibers, runs into aryepiglottic fold and attached to the epiglottis. That is named as a, that is a thyroepiglotticus. So these all are the, you have to remember about the 9 muscles of the intrinsic muscles of the larynx. So I hope, my dear students, you have understood the all these muscles, small muscles. You have to remember about the origin insertion. So I have covered the thyroarytenoid, cricothyroid, posterior cricoarytenoid, lateral cricoarytenoid, transverse arytenoid, oblique arytenoid, aryepiglotticus, thyroarytenoid, Hocalis, thyroepiglotticus. All these are the 9 muscles, intrinsic muscles of the larynx. Next comes about the, almost all this larynx is supplied by the intrinsic muscles of the larynx supplied by the recurrent laryngeal nerve. Recurrent laryngeal nerve, which are supplying to the, you are going to get about the supplied to the recurrent laryngeal nerve, supplied to the all the muscles of that is of the, very important point I am talking about, the nerve supply of the muscles of the larynx. All the intrinsic muscles of the larynx, these all muscles of the larynx are supplied by the recurrent laryngeal nerve, except cricothyroid is, which is supplied by the external laryngeal nerve. Almost all recurrent laryngeal nerve inside. Cricothyroid is outside lying muscle. So this is the external, that is a laryngeal nerve supplied to the cricothyroid. So that is, you have to remember in the total. What are these actions of these laryngeal muscle? These actions, muscle which opens the glottis. When you see the glottis and all, here you have to remember, here this epiglottis, glottis, you have this opening is important. Muscle which open the glottis is posterior cricoarytenoid. Closing the glottis is lateral cricoarytenoid, transverse arytenoid, cricothyroid, and thyroarytenoid. Muscle which tense the vocal cord. This vocal cord, when we speak, and it is tensed by the cricothyroid muscle. Muscle which relax the vocal cords, thyroarytenoid and Hocalis. Muscle which close the inlet of, this is inlet of the larynx, oblique arytenoid and epiglotticus. And muscle which open the inlet of larynx, that is a thyroepiglotticus. So this is all about the, you have to know about the, almost all the, uh, about the actions of the intrinsic muscles of the, that is the larynx. So what I have told, action, muscle which opens the glottis, close the glottis, muscle which tense the vocal cord, muscle which relax the vocal cord, muscle which close the inlet, muscle which opens the inlet. So this is, you have to remember in the total larynx. Then blood supply is by the superior and inferior laryngeal artery, that is a blood supply to the larynx. And the superior laryngeal artery is a branch of superior thyroid artery. Inferior laryngeal artery is an inferior thyroid artery branch. They are supplying. And veins is corresponding. Superior laryngeal vein, inferior laryngeal veins. They are drains into the, that is a superior thyroid vein and inferior thyroid vein, corresponding artery, corresponding veins. So blood supply of larynx is by the superior laryngeal, inferior laryngeal artery. They are the branch of superior thyroid, inferior thyroid artery. Venous drainage is by the, you have the superior laryngeal vein, inferior laryngeal vein. They drains into the superior thyroid, inferior thyroid veins. Okay. So lymphatic drainage, they drains upper part of the, this all about the lymphatic from the part above the vocal folds, drains into the anterior superior group of deep cervical node. You have the deep cervical node, upper part, lower below the vocal folds, lower part, which is drains into the deep cervical nodes of the fused chain. So you have to know about the prelaryngeal nodes. So this is all about the lymphatic drainage. So I have covered the introduction, measurement, size, location, the cartilages or constitution of larynx, then cartilages of the 9 cartilages, 3 paired or 3 unpaired cartilages. Then I have told the intrinsic muscles of the larynx about the 9 muscle and its origin, insertion, nerve supply I have covered. Then I have covered the blood supply, venous drainage, nerve supply, and lymphatic drainage of the larynx. Last part we are going to deal about the, that is the clinical anatomy of the larynx. See, when this is a respiratory passage, any foreign object enters into the larynx, it produces the cough, severe cough, to expel it out. So that is the one which is you have to know about, the expel it out by the production of cough. When the any foreign object enters into the larynx, it causing irritation of the mucous membrane, producing cough, and two, this cough is produced due to expel it out. However, damage to the internal laryngeal nerve produces the anesthesia of the internal laryngeal nerve is damaged, then it is causing the anesthesia, loss of sensation, that is caused at the supraglottic part of the larynx. This is the second applied anatomy point. Third one, damage to the external laryngeal nerve. You know damage to the external laryngeal nerve because outside muscle is cricothyroid. Then what is the action of cricothyroid? That is lost. So causes the weakness of phonation. External laryngeal nerve is damaged, it causes the weakness of phonation, means voice is low pitch and it is a weaker. So loss of the tightening effect of the cricothyroid. So that we are going to call as a damage to the external laryngeal nerve causes the weakness in the phonation. So that is you have to remember in the applied anatomy. So this is a third applied anatomy. First applied anatomy, any foreign object enters into the larynx, it causes the severe cough to expel it out from the larynx. Second, damage to the internal laryngeal nerve produces the anesthesia of the mucous membrane of the supraglottic area. Third one is, if the damage to the external laryngeal nerve causes weakness in the phonation due to the loss of the tightening effect of the cricothyroid. I have told cricothyroid only one muscle which is supplied by the external laryngeal nerve. Its action will be the tightening effect of the, that is a loss of the tightening effect of the cricothyroid on the vocal cords. Vocal cord tightening is not done. So that is weakness in the voice. When both recurrent laryngeal nerve are interrupted, the vocal cord lies in the cadaveric position. It does not move, it is stable, and phonation is completely lost, and breathing also becomes difficult. When now I have told one nerve is damaged, what happens. But when both recurrent laryngeal nerve are interrupted, the vocal cord lies in the cadaveric position. Mean cadaver means dead. Cadaveric position means the dead position. Means what? It is in the stable when it is in one position. It is not moving on closing, opening, or in the one position. That that may leads into a complete loss of breathing. It may have, and a complete loss of phonation can occur. When only one recurrent laryngeal nerve paralyzed, the opposite vocal cord will be compensates. Means what? One side is laryngeal nerve is affected, other vocal cord will be taking part. So there may be the chances of the little bit about the that is for its, and phonation is possible. Phonation means voice production is possible. That is about the only one recurrent laryngeal nerve is paralyzed. Then next comes about the next, applied anatomy of the larynx. The larynx can be examined either through the, we want to examine this larynx here, interior of the larynx is weak by this one instrument we call examine the interior of the larynx, upper part of the trachea. Here, interior of the larynx, that we call as an laryngoscope. Instrument name is laryngoscope, and procedure we call as a laryngoscopy. That is visualizing the interior of the larynx by the instrument known as a laryngoscope, and visualizing interior of the larynx, this procedure we call laryngoscopy. Then since larynx is the narrowest part, this is the narrowest part of the respiratory passage, foreign body, anything, I have told foreign body enters into here. Suddenly, hurriedly we are eating, that time there is a entering of food in the larynx. It may produces the cough, severe cough. So that is you have to remember. Since the larynx is the narrowest part of the respiratory passage, foreign bodies are usually lodged here. Means what? Foreign body which are not entering into the trachea directly, it is they are obstructed here at the laryngeal part. So that is we call as the narrowest part of the respiratory passage. Inflammation of the larynx we call as the laryngitis, that is characterized by the hoarseness of the voice. होर्सनेस घसा बसणे म्हणतो आपण. घसा बसणे म्हटलं तर दिस इज ऑल अबाउट द laryngitis. Means pharyngitis. Pharyngitis means it may include all three parts: naso, oro, laryngo, pharynx. But specifically laryngopharynx is involved, then there is a chance of there is a characterized by the hoarseness of the voice. Gasa basne, hoarseness. That is the inflammation of the larynx, laryngitis. Laryngeal edema may occur due to the variety of the causes. Sometimes this larynx is swollen because the edema we call, and this is a variety of causes then cause the obstruction to the breathing. One commonest one is anaphylactic shock. When we give the injection to the patient, penicillin or any causing anaphylactic shock drug, person is sensitive, that time reaction we get medicine, that is, and that may cause, that is causes the laryngeal edema. Laryngeal edema causing the breathing difficulty, then a person may die because of the laryngeal edema due to the drug in reaction or anaphylactic shock. That time we have the laryngeal edema getting, and person may die on table because of the laryngeal edema. He cannot, edema means swollen, blocked, airway is blocked, so you cannot breathe. So then suffocation, or a patient may die because of the laryngeal edema in the anaphylactic shock. So this is all about the larynx. I hope that is understood. The almost all this is uh, larynx. So any questions you have, please ask. 3 minutes are remaining. So you have anything questions, ask. Who was the given me this topic? she discussed with the joined or no?
Yes, sir.
What is your name?
Mugdha Parchure.
Ha, Parchure. Are you understood the topic or no?
Yes, sir. Yes,
Are,
sir.
is there any difficulties?
No, sir.
Okay, you practice the diagrams of all the diagrams of muscles and cartilages. That is very important to write in the.
Okay, sir. Yes, sir.
So next topic which you want, tell me fast. Anyone which we have? Yes, almost all I have covered. The Saturday I am going to engage. So your exam will be declared. I hope that is you know all this one. 2 minutes are remaining. Just you have to remember your exams are declared and it is in the next month, 24th. Timetable was displayed on the college notice board, even university website. You can go through that and exam will be conducted on 24th November. So exams will be after Diwali starting immediately. So be serious and study. And one more thing is you have to complete and keep it about the journals. Journal and illustrative, both you have to complete it. Be ready because only I may sign you anytime when you come for the oral or anywhere. So you should keep it ready, all the journal topics and all the illustrative must completed. I hope that is you understood that that is a must you have to remember. Okay, so this is all about the. And one more thing, I have quality of larynx. I have told the this in the applied anatomy. Only 1 minute is remain. How I can explain? I don't know. So only 1 minute I will complete. Quality of larynx. Lata Mangeshkar at the age of 70, 80, how she is singing properly. This is 3644 mm of the larynx. That is a quality of larynx. You have to remember a very beautiful song sung by the Lata Mangeshkar. That is a quality. You can see the that is your larynx are also very quality. If you shout very loudly and all shouting, that is also quality of larynx. टू दॅट इज जोरात वरडणे म्हणतो ना, जोर जोरात आपल्याला येतो, गाणं म्हणू शकत नाही, नाहीतर कानात ते बंद करून ऐकतील. So larynx you have to remember. So that is the quality of larynx you have to remember. A very small organ that is. Okay. Anytime we may close or conclude the lecture. So this is all about the about today's that is the larynx. So anyone wants to next any difficulties topic, you can send me to the topic or any you want to